At HealthCare Partners Medical Group, our mission is to provide the highest quality of healthcare to each and every patient. With 5 locations in Pahrump, we are local doctors you know and trust. We want to thank you for choosing us. Quality care starts here.
Vaccinations are very important for kids, and there are some requirements in Nevada for preschool. There are also, certain vaccinations need to be given, and those includes DTaP, polio, MMR, and chickenpox, and at least one of those needs to be given before after they turn 4 years, and there are also immunization requirements for the 7th grade, and for all those kids they need a tetanus and the whooping cough booster, and they get it after they turn 11.
They have immunizations cards that that the doctor fills out every single time, so it kind of gives you the guidelines of what you are required for school, right?
Yes.
So if you have a new your child is just entering school for the first time, there's a minimum requirement of immunizations. What if our parent doesn't want to do immunizations?
Now, we do work along with the patient. Okay. Now, there are certain requirements for the school. They usually school doesn't allow without vaccinations unless there is any real medical reason, and if there is a medical reason, we sign those forms. If there is none, and there is some religious concerns, I think parents can also work along with the school. But we definitely recommend vaccinations for all, and it's helped to prevent lots of curable diseases, preventable diseases.
So everybody who's getting ready for school right now can get these shots before they start school, I believe, next week. Chickenpox immunizations, how are those going now?
Now, chickenpox immunizations, they need now Nevada also, the school board also requires a second chickenpox vaccination, and so it needs to be 2 doses, and one of them has to be after the 4th year.
Okay. And then, so for school, it's required when they enter, and then 7th grade as well, or different grades all throughout the years?
Yes. So that's a good question. Now, for school, for the kindergarten, actually, there are certain requirements, and once you're done with the requirements, they don't usually need anything until their 11th grade, until their 7th grade, and that's at 11 years. One of them, we just discussed, the tetanus and the whooping cough booster is required for the school, but there are 2 other shots, which is the meningococcal vaccine, which prevents meningitis in teenagers, and there's another one which is very important for girls and boys now. It's Gardasil, which is a vaccine to prevent HPV-related cancer, cervical cancer, in girls, and genital warts in boys. So
That's something required or not required?
It is not required, but we definitely recommend.
Definitely. That is something that is such a breakthrough, that vaccination for the girls and boys there. This is something that if you have a teenage child and you would like to get a vaccination done, what is that like? You get one and then you get an additional vaccination?
Yes, it is a 3-dose series. The first dose is given, second dose is given at least 2 months after the first dose, and the third dose is given at least 6 months after the third dose, after the first dose. So total, the 3 doses need to be finished within 2 years.